How do we define normal blood pressure as we get older? This is a question that comes up all the time, and this doctor is going to answer it for you. Hey there. Welcome to the channel. Today, we're going to talk about what is considered normal blood pressure after 60, or in fact, after 50. As most of you know, blood pressure tends to creep up as we get older. But what is the new definition of what's normal? What is pre-high blood pressure and what is actually high blood pressure? We'll talk about all of those things today. Now, if you're new here, we would love to have you subscribe. And when you do that, we suggest you turn on notifications so you don't miss any future videos. The reason why is that we bring new videos every single week on topics like this one. Also, if you find value in this video, please give it a like because that tells us you want to see more videos just like this one. So let's get right into it. Many of you might be aware of the old adage that says blood pressure goes up 10 millimeters of mercury each decade after 30. So many of you would say if my blood pressure should be 120/80, then at 40 it should be 130/80, at 50 it should be 140/70, and at 60 it should be 150/70. And the truth is that is not correct anymore. Now, you may have heard that recently the guidelines for blood pressure have been changing. They changed last year in 2021, and many people are unaware of these changes. Let me explain them to you. First off, let's start with what was normal before and what is normal now. In the past, we used to define normal blood pressure as anything less than 140/90. Anything from 140/90 to 159/100 was considered pre-high blood pressure, and anything 160/100 or higher was considered stage 1 hypertension. Now, under the new guidelines, normal blood pressure is defined as anything less than 130/80. Between 130/80 and 139/100 is considered elevated, and between 140/100 and 159/100 is considered stage 1 hypertension. Anything 160/100 or higher is still considered stage 2 hypertension. Now, some doctors and medical professionals will argue this definition of normal blood pressure is wrong, and some studies have even shown that a lower blood pressure may be better for your health. However, until the scientific community can come to an agreement on a new normal, for now, the guidelines say that anything 130/80 or lower is considered normal. Let's take a look at what the blood pressure actually means. So blood pressure is a measurement of how hard the blood is pushing against the walls of your arteries. When you have your blood pressure checked, you will see two numbers. One is the systolic blood pressure and the other is the diastolic blood pressure. Systolic blood pressure is the top number and that represents the pressure in your arteries when your heart beats and pumps out blood. Diastolic blood pressure is the bottom number and that is the pressure in your arteries when your heart is at rest between beats. Blood pressure is measured using a sphygmomanometer. This is the device that has the large cuff that goes around your arm. Inside the cuff, there is a bladder that gets inflated to take the blood pressure reading. To take a blood pressure reading, the bladder is first inflated, trapping the blood flow in your arm. Then the bladder slowly releases air, allowing blood to flow again through your artery. As the blood flows, it makes sounds that can be heard through the stethoscope. These sounds are called Korotkoff sounds. The blood pressure reading is taken at the point where the sounds are no longer audible. The stethoscope is placed on your arm either over your brachial artery, which is the artery in your arm, or over your popliteal artery, which is the artery behind your knee. Either location can be used to check your blood pressure and the results will be the same. Blood pressure can fluctuate throughout the day. It can change with your activity levels, stress levels, medications, and many other factors. For this reason, it is recommended to check your blood pressure at multiple times throughout the day to get an accurate reading. And it is also recommended that you check your blood pressure at home so that you can see how it fluctuates throughout the day. If you want a home blood pressure monitor, we've put a link to our favorite one in the description below. A couple of quick tips to ensure you get an accurate blood pressure reading is number 1, make sure you are relaxed before checking your blood pressure. If you are nervous or anxious, your blood pressure will be higher than normal. And number 2, make sure that the cuff is the right size and it is placed correctly. If the cuff is too small, the reading will be artificially high. If the cuff is too big, the reading will be artificially low. Now, as I mentioned before, the blood pressure guidelines were updated in 2021. The main reason for the change was due to the results of a study called the SPRINT trial. In this study, researchers found that intensive blood pressure control, meaning getting your blood pressure to less than 120/80, was associated with fewer cardiovascular events and strokes. However, there were some concerns about the safety of having a very low blood pressure. Some people in the study did experience an increase in kidney problems, a decrease in urination, and some became dizzy. And for those reasons, researchers said that the findings should be interpreted cautiously. It's important to note that the SPRINT trial did not look at overall mortality, meaning death from any cause. Instead, the study focused on major cardiovascular events, including heart attack, stroke, and cardiovascular death. If you have been diagnosed with high blood pressure or if your blood pressure is consistently elevated, you should continue to work with your doctor to get your blood pressure under control. There are many different ways to manage high blood pressure. Lifestyle changes such as eating healthy and exercising can help lower blood pressure. Medications are also very effective at lowering blood pressure. There are many different classes of blood pressure medications. Your doctor will work with you to determine the best medication or combination of medications for you. Some people may ask whether or not they need to worry about a blood pressure reading that is slightly elevated above the new normal range. The answer is yes. Having a blood pressure reading that is slightly elevated can be a sign that you are at increased risk for developing hypertension in the future. It can also be a sign that there are other risk factors that you may not be aware of. That is why it is important to see your doctor regularly and have your blood pressure checked at least every 2 years. Also, remember that blood pressure can fluctuate throughout the day. So if your blood pressure is elevated one time does not mean that you have hypertension. For those of you who think that the new definition of normal blood pressure is too low and that it will cause problems because of the side effects of medications used to lower blood pressure, I would say that you raise a valid concern. I am not a fan of giving medications to people without a proven indication that the medication will benefit the patient. The concern about low blood pressure causing problems is a real concern. The reason the guidelines changed is due to the results of the study that showed that getting the blood pressure lower resulted in less heart attacks, less strokes, and less cardiovascular deaths. However, there were some side effects that occurred, mainly affecting the kidneys and some people becoming dizzy. As I mentioned earlier, these guidelines have only been in effect for a little over a year, and over time, we will see what the impact of these new guidelines is on people's health. If it turns out that there are negative consequences from these new guidelines, I am confident that the medical community will revisit the guidelines and adjust them accordingly. So in summary, the new normal blood pressure is less than 130/80. Anywhere from 130/80 to 139/100 is elevated. And if your blood pressure is in the 140/100 to 159/100 range, you have stage 1 hypertension. And if your blood pressure is 160/100 or higher, you have stage 2 hypertension. Thanks so much for watching today's video. Remember to subscribe so you don't miss any future videos. And if you found value in this video, please give it a like.